Hello, everyone. This is Megan Ido. I am doing my presentation on the Zika virus. What is the Zika virus? The Zika virus was found in Uganda originally in 1947 in the Zika forest. There were cases then reported in 2015 in Brazil, South America, Central America, as well as the Caribbean. It actually did not reach the United States until 2016, and that was found in Florida. There have been no diagnosed cases from mosquitoes since 2018. It is transmitted to humans by the bite of an infected mosquito, usually the Aedes aegypti. It can then be spread human to human by sexual intercourse. Most people do not become sick from it, but 1 in 5 individuals will develop a fever, rash, and conjunctivitis, which is reddening of the eyes. If you are pregnant, the virus can then be transmitted to the fetus, which can cause birth defects, mainly microcephaly, which is a smaller head. It can also cause missing limbs and a variety of other defects. Who is affected? This affects humans. The most out of concern are pregnant people or those who are trying to become pregnant because of how it is transmitted to the fetus and the cause of birth defects. It also affects anyone who is traveling to areas where Zika is prevalent or if you live in those areas. Testing, there are 2 types of testing. The first is molecular testing. These are also called nucleic acid amplification tests, and they look for genetic material from the Zika virus. The PCR test is typically what's used for Zika to check your blood or urine, but it is not recommended when you are pregnant. This is also similar to if you have the COVID test, it's a PCR test as well. The other test is antibody testing. The antibody test checks your blood for any antibodies that fight the Zika virus. However, since it takes a week for your body to make antibodies, it is recommended to wait till the 7-day mark after your symptoms begin to get this test. The infection window is 3 to 14 days. That's how long the Zika virus needs for incubation. Symptoms will typically develop within a week for about half of those infected, and then 2 weeks for 99%. And then right here, I have the charts showing the onset of symptoms and the incubation period for those affected by the Zika virus. How to stay safe. You need to prevent mosquito bites. This means bug spray, make sure it has DEET in it. That is what keeps them and kills them when they come in contact with you. Wear protective clothing. So if you're in an area where there's a lot of mosquitoes, try to wear long sleeves, hats, pants. If you're working in the garden, wear gloves. Just like extra precautions. Don't forget your sunscreen. And then the other thing is to practice safe sex. So if you are trying to conceive or you are pregnant, you want to make sure that you are following those top 2 as well. Just be cautious. Some bug sprays are not recommended for pregnant women, so you want to make sure you talk with your physician first and then go over your options. And these are my references. Thank you.